Hi friends, today I'll be talking about a different kind of headache. It's called cluster headache. So the name itself suggests that it's a different headache from migraine. What happens is migraine tends to happen like an attack once in a while, like a week, 2 times a week or once a month, things like that. Whereas cluster headache is slightly different. There is some similarity also, but there are some differences. So I will explain these differences. The important thing is cluster headache is not that different from migraine. Okay, so I'll give you a brief guide so that you can understand properly what is a cluster headache, right? So it's basically the technical term is episodic cluster headache. It is rare, but it tends to be extremely painful. And this type of headache that occurs in a cyclical pattern, right? It comes like a cluster. It is so severe that sometimes it's called suicide headache. Yeah, it's a strange name, but it has been used by people. So what exactly is it? It's basically a neurological condition and it produces sudden severe headaches on one side of the head. And most of the time it's around the eye. It typically lasts for about 15 minutes or up to 1 hour or 2 hours, maximum 3 hours. That's the usual thing. Of course, there are variations. And they usually occur in clusters, like for a whole entire week, and then there is, or for a month, and then there is a long period when there is a remission, the person doesn't have any headaches, right? So now I'll describe, this is the pattern, and I'll describe a typical pattern. Like the attacks happen at the same time each day. People tell me, okay, at 10 a.m. I know it's going to start. Sometimes people wake up from sleep, and that's a very typical thing. People say, okay, I was sleeping and then I suddenly woke up in the middle of the night, and then this goes on every night at that same time, right? Headaches can even occur up to 1 to 8 times per day, right? So that is another thing to remember. And most people either have 1 or 2 such clusters throughout the year, right? I have seen people who have had only 1 in a year, but some people every few months they tend to have it. So what is the underlying reason? What is the mechanism? What is happening inside the brain? The thing people believe is that there is an area in the brain which is called hypothalamus, which controls the normal rhythm, the day-wake cycle and all those cycles. And this activates the nerve center, right? The pain center, which is the trigeminal nerve pain center. And then, of course, there are associated symptoms, which we call autonomic. So there is watering in the eye, there is drooping of the eyelid, things like that. So along with the pain around the eye starts also to water, right? And then it tends to have some redness and all these things. It's somewhat rare. It's about 1 in 1,000 people. Migraine is about 20 in 100. So you can see how much difference it is. It is more common in men, whereas migraine tends to be more common in women. It is more common between the age of 20 to 50 years. Yeah. Now, smoking is a significant risk factor for cluster headache. Right. So these are some of the things we need to remember. But people ask me, is it genetic? Am I going to pass it on to my kids and things like that, right? Now, family history is seen in about 5 to 10% of cases. Genetics does play a role, but that doesn't mean it is familial. The exact genes are still under study. We don't know. Okay, so don't think that, if I have cluster headache, my next generation is also likely to have it. There are very few families who have been described like that. So what are the treatments? See, one treatment which is mentioned quite regularly is 100% oxygen inhalation. Now, I find there is a practical difficulty, because what happens is the cluster headache itself, the attack itself lasts for about half an hour, maybe 1 hour or so. And most people, I've had this experience. They say, okay, I'm driving at 10 o'clock in the morning. I'm in the middle of traffic, and then this thing strikes like a lightning, and it's so severe that I just have to stop somewhere. I park my car and I wait for it to get over. Now, think of this person. Now you're telling him, okay, you need to take oxygen at that time, right? So nobody's going to keep oxygen in their car, right? Because it's against regulation. So he has to reach a hospital, and there the hospital has to provide him the oxygen. That is the only way. The other thing is at home, right? So supposing in the middle of the night somebody wakes up with a headache, they would have to get the paraphernalia, keep it ready, and inhale 100% oxygen. But the point is that if you are able to do this, it can finish the attack very quickly. So that's a very good option. Other options are something like treatments for migraine. we give sumatriptan, zolmitriptan, those medicines, right? So sometimes they are useful. I've used it also, and I find sometimes they are useful. Now, about preventive medications, like for migraine, we have so many medicines, but for cluster headache, the most commonly used one is verapamil. It's not easily available. The difficulty I face is that insurances don't agree to cover with this medicine, because verapamil is actually a medicine for the cardiac condition, right, arrhythmias. So to use it for cluster headache is slightly not a accepted method, right? Now, in the short term, sometimes steroids have been used, topiramate has been used, and lithium also. Lithium is actually antidepressant, but here it has been used. And in some cases, nerve blocks and neuromodulation have been used. One new medicine which has come up is the trade name Emgality, galcanezumab. It's an injectable and it's a single dose, and it's a CGRI inhibitor. So it's a new method of treatment, and it is licensed for treatment for cluster headache. So this is what I wanted to share about cluster headache. If you have more questions, do post them in the comment section below, and let us know what other things you want to hear from us, and I'll see you in the next video. Thank you.